Cadillac's hit music station, 107.9 CDY, pausing the music for the next half hour for some very important local topics. It's Cadillac Unscripted. It's sponsored by Independent Bank. Katy Huckle is my co-host. And today we are welcoming back to our show Dr. Jim Whelan.
Right, the man of the hour. You know, Rich, we all need answers to questions, and we're all kind of, on pins and needles about this COVID variant. And so, welcome, Dr. Whelan. We cannot wait to be updated by you.
Thanks for having me back, and I'm glad to be here.
Okay.
In a way, Dr. Whelan, I wish we didn't have to have you back.
I know.
Don't take that the wrong way, but we got to talk about this.
We do. Update us. Tell us what's going on, please.
So we had a really good summer in terms of cases in Cadillac. Things really, from May through June, dropped quite a bit, and we didn't have anyone in the hospital for almost a month with COVID in Cadillac. But beginning about the beginning of August, we started to see an occasional case, and now cases are definitely rising across the north here and in the Munson healthcare system.
Oh, no. I'm sorry.
So the difference between the Delta variant and what we have been fighting with previously, what is the main difference?
There's really one main difference, and that is how contagious it is. So one of the ways we measure how contagious bacteria or a virus is on average how many people can or will catch it from one infected person. So hard-to-catch viruses might infect one or two people. Each sick person would infect one or two people. And very contagious viruses, that number might be as high as 20. The original COVID variant was in the low range, 2 to 4, using that scale. And the new Delta variant is probably closer to 10. So say you were in a crowded room back in the beginning of the pandemic and someone was in the room with COVID symptoms. How many people would have left the room having caught COVID? It wouldn't have been very many, even back then with no masks. It would have been a couple or 3. But now if you're in a crowded room or Faster Horses concert or Lollapalooza and you are around someone who has the Delta variant, about 3 to 5 times as many people will leave eventually having the virus.
Oh, dear.
Well, and I know recently there was a concert at Soaring Eagle, a country concert, and I did see the message that from the Central Michigan Health Department that 6 people were identified there, and that was an outdoor event.
Isn't that something? So, Doctor, what should we be doing? What should we, the public, be doing?
So, unfortunately, we have to go backwards a little bit. Like I said, we've had a good summer. We've all felt good and safe not wearing masks. You could go to Meijer and not wear a mask if you were vaccinated. It really kind of felt, whoa, maybe we're going to get back to normal. But we have to go backwards for a while here. The vaccine is effective at reducing the severity of illness with the Delta variant. However, vaccinated people, they've shown, do still carry a large viral load, meaning they will spread it. So they might not end up in the hospital. They might not even have any symptoms. But if they're that person in the crowd, they could still give it to several people. So the recommendations have gone backwards. Even vaccinated people should wear masks in enclosed spaces. So back to wearing masks at Meijer, back to wearing masks when you're in stores. That's for vaccinated and unvaccinated people. Outdoors is probably still safe as long as you can maintain reasonable social distance. If you're going to go to an outdoor concert where you are, jammed in like sardines, that's probably not much safer than being indoors. But if you're at a picnic and everyone is, 3 to 6 feet apart, outside you don't need to wear a mask. So the other thing we really can do is get vaccinated. So we're still at relatively low numbers. It's just 2 positive patients in the Cadillac Hospital. As you see in the paper, the number of cases that are positive in the county aren't super high. You have time to get some protection from a vaccine if you've been hesitant up till now. The vaccines do work. The 2-dose vaccine's better than the 1 dose, and the second dose really helps your protection. So getting to that second dose is important, but delaying isn't going to help. So we would really, really love to see a significant number of those who are still on the fence get that vaccine.
My perception of this, Dr. Whelan, is the people who wanted it got it. Mm-hmm. The people who don't want it aren't going to get it. So what can you say to those folks who are like, the government is tracking me and I'm losing all of my personal freedom and
it's conspiracy theorists.
All the conspiracy theorists. And what can you say to change their mind?
Mm-hmm.
So it's not really conspiracy. Let's be fair. Many people have really actually done research and feel well informed, but a lot of the information out there we would call misinformation as part of the medical establishment, but it is persuasive misinformation, meaning it's couched in medical terms, and it plays on the uncertainty that goes with all of healthcare. So I don't want people to feel like we're criticizing them if they have done the research and they feel like they're making a good decision. The important thing, and some of those people will never convince, and that's okay. They accept their risks. There are still a significant number of people. So we're somewhere around 60% vaccinated in our community, and really to help limit how fast a variant could spread, we need to get into the 70s. There are a lot of people waiting for final FDA approval to feel like it's really been tested adequately and safe. And there are those who still may have struggled to get the vaccine. So there are still many, many options to get it. And the full FDA approval is expected in the next few weeks to reassure those who have just wanted to kind of take a wait-and-see attitude.
I know that there are those who are waiting because the FDA did an emergency approval. And you're saying this is not far off, Dr. Whelan?
Oh, no, it's believed that it's going to happen in August or by the beginning of September.
Okay.
So that is really good.
So question, Dr. Whelan, does the Delta variant make people sicker?
It's still a little uncertain, but probably yes. If you're unvaccinated, you are a little more likely to end up hospitalized with the Delta variant, but not a huge amount worse than the previous strains.
Okay. What about travel? What would you recommend? I mean, I can kind of hear when you're talking about concerts and getting packed in like sardines, probably not the best idea. But what about folks that have, end of the summer vacations planned and things like that?
I would say if you're vaccinated and you wear a mask, you can be pretty confident that it's safe to travel.
Okay.
If you're unvaccinated, as much as we dislike them, I would definitely wear a mask. And if you are unvaccinated with chronic health conditions, I would be cautious and reevaluate your decision.
And it is interesting because, for about 12 to 14 months, life as we knew it was kind of discouraged. And so when things kind of got freed up early this summer, the lid came off. People were ready to, cabin fever, we were ready to get out and live. And,
right.
and obviously we're not far away from school starting again. So, there's going to be a lot of that travel and a lot of that scratching of traveling itches going on,
That's right.
Yeah.
Yeah, and we've seen a giant increase in outdoor type activities. Number of people getting fishing licenses, the number of people camping, the number of people hiking. Those are all awesome things, super healthy, outdoors, safe. We want everyone to do as much of that as they want. Getting on a plane, going to a crowded concert, though, that's where those kind of caveats I gave earlier would really apply.
Okay. What about our fall athletes in sports?
So the CDC has recommendations about masking, and I think that there will be some recommendations about how to do that. We've learned a lot over the past school year about how to do it safely. I suspect we'll still have some testing requirements and some masking requirements, but I do not expect any cancellations. I think if you're a high school athlete and you truly want to enjoy your season, you're going to be a senior and it's important to you, you should get your shot. Like, you're eligible, everyone over 12, and you should get your shot. And you are very unlikely to miss time because you are sick. And that's our goal. You should encourage your teammates. Why risk disrupting your season over that? So that would be a way to approach that. But I do fear that the Delta surge is going to kind of be around its peak at the start of school. And so we will still have some classrooms that are quarantined, less than last year. But I think we have also learned from last year that we should keep schools open and kids in person as much as we can, that the harm of virtual learning and social isolation probably outweighed some of the COVID risks for kids with normal immune systems.
Okay. All right, we're going to go to break. More with Dr. Jim Whelan, our community leader and COVID expert. We'll be right back with Cadillac Unscripted.
Back on Cadillac Unscripted, 107.9 CDY. We're sponsored by Independent Bank and another important show. Katy Huckle is with me right now. We have a medical director from Munson Hospital Cadillac, Munson Healthcare Hospital Cadillac, Dr. Jim Whelan. And we've got 15 minutes left and a ton of questions.
We sure do, yes. So, Dr. Whelan, you mentioned that we're at about 60% vaccinated. And as we know, that does not include our 1 to 12-year-old population. So they're outside of that number. And so when we look at that 60%, and you say you'd like to get into the 70s, can you explain who and I know demographically it's hard to pin it down, but who isn't getting vaccinated and why reaching up into the 70s is so important? And two-prong here, how are we doing in comparison to other communities in the state of Michigan?
A great question, Katy. I guess I'd start by saying District Health Department 10 does a great job of getting out their report on who is and isn't getting vaccinated in our area. And it's in the newspaper and publicly available on the District Health Department 10 website all the time. The real gap is in the 12 to 30-year-olds. So, like everything in healthcare, the young teenage and 20-year-olds who feel invincible are lowest, least vaccinated, and probably are most likely to gather in crowds.
Oh, dear.
So, yeah, and your listening areas, counties, lag behind the state in terms of the percent of people who are eligible who are vaccinated. Some counties by quite a bit. And as you've seen in the news, the Delta variant loves to spread in areas with low vaccination rates. And I've been trying to think of kind of how to think about why does lower or higher vaccination rates break down a surge. And I guess I'll kind of describe it like this. We used the analogy earlier of a crowd and the original variant. And if you're in a crowded activity and one person has it, they could share it with two others. So say that number's 5 now, and that's not an exact scientific number, but we'll just use it as an example. So if you are in a room of 100 people, and 60% of them, so 60 out of 100 are vaccinated, so less likely to get it, and someone comes there, you would have 5 potential people, so that person could breathe on 5 people, and they're going to catch it. But out of that 5, it turns out 3 are vaccinated. So you really are back down to just 2 people who are going to be catching the virus, and it's going to spread in that same way. Like he told 2 people, and they told 2 people, and they told people. That's fast. It doubles all the time, but it's still slower than they told 5 people, and they told 5 people.
I see.
Now, if we get to 75 or 80% vaccination, instead of 2 people out of those 5, only 1 out of those 5 is actually going to get it.
Mm-hmm.
So you can imagine how much slower things spread and how more likely it is to fizzle out if you can only spread it that way.
I see.
So does that kind of make sense?
It sure does. The word that came to mind is it's the multiplier. It's reducing the multiplier. Mm-hmm.
That's a great word, and I think that really resonates.
Okay. So you mentioned these young folks. Can we talk about mental health for a minute and what you said about, we've learned that our kids need to be in school and our kids need to socialize. How are we doing from how's the community doing, and how are our kids doing in terms of mental health?
Well, it's a great question, and we have to pay some attention to this, Katy, because, for example, the Wexford PHO has a grant there working with the schools on screening and identifying kids struggling with anxiety and depression. And they have seen a massive increase. So they did a screening at one of our local schools where they screened every child, and I forget the exact number. Over 50% screened positive for having anxiety.
And that is not a surprise to me, Dr. Whelan. I've at the Career Tech Center where I'm a parapro, I took a lot of kids out into the hallway and said, "Hey, where are you at mentally?"
Right.
It was more about finding out where they were and how they were doing, as much as teaching them this past year.
Is that right?
Yeah. Yep.
And so some of our most vulnerable kids also didn't go to school. They choose virtual options because they don't thrive in the school system anyways, and so they thought that might be a better choice. All of those things isolated them. Kids thrive on social interaction, and so having lost a degree of that, the conflict they sense in their communities, between maybe it's their parents in school, or between their parents and their siblings or their neighbors. I mean, we've had just such a conflict-filled last 2 years. All of that, kids, they might not be able to verbalize what's feeling stressful to them, but they sense that tension, and it is weighing on them. So we really need to get our kids back to normal as fast as we can.
It's funny, not funny, but you talk to some of these students that didn't like school before. They missed structure. They missed having to get up at a certain time and having to be someplace at a certain time and lunch at a certain time, and even the predictability of what was going to be presented in the cafeteria versus being at home and going into the pantry and having to make a sandwich type thing. And so I talked to some students that they didn't even really like going to school, and they missed it. They missed school, and they missed even their teachers.
Yep. I bet that's more common than we would have guessed.
Wow. So how do we help these students that it gave me the chills when you said more than 50%? What can be done to help them?
We have to get back to normal. So this is and I might be a little outlier here. I mean, I don't know the where the CDC is going to go depending on how high the surge gets and those recommendations, and the same with schools. But I personally believe the risk-benefit, we thought last year was that the risk of the virus was worse than the risk of disrupting the school year. And I don't think we believe that anymore. Okay. I think preserving the school year and school activities and all that is a much higher priority this year. And the virus is a risk, and we can vaccinate kids, and hopefully soon we'll be able to vaccinate those 3 to 11, and then it won't be risky at all to go to school. We really can feel like it's more normal, and that's, I think, really important for kids.
So it's very important, Dr. Whelan, to let our kids know that what we're going through right now isn't overall as severe as what we saw last year. Correct? In terms of the number of people infected. And the
Correct.
The having the specter of having the school year or part of the school year lost or anything like that. We don't see that happening this time.
I think it's much, much less likely. It would have to be something really unforeseen to do that. And I think our educators are as committed to that as the healthcare professionals.
Wonderful. Dr. Whelan, for that segment of the population, you used the word invincible, and that's the perfect word. We all remember being young and feeling invincible. What would you say to them? I mean, Rich has this joke that he says, like, don't get on Facebook and talk to your Uncle Eddie about what he thinks about COVID. Go to the experts. Go to the health department. Go to Dr. Whelan. What would you say to our young people that haven't been vaccinated?
I would say listen to the stories of their friends and families. So it's true that if you're a healthy 20-year-old, your likelihood of going in the hospital is pretty low. But if you were to spread that to your grandparents or to, a group of people, and they were to get very sick, because you didn't take it seriously, that would bother you. And it's avoidable. And so this is the beginning of kind of some personal responsibility in terms of the world's not just about you, and maybe it's time to start thinking about others. Well, when we're in this very unique and unprecedented pandemic.
Well said, right there. Question. So it's Thanksgiving, and you invite your family over. Is it going to become socially acceptable to say to folks, I'm sorry, you need to get vaccinated to come to my home? What are your thoughts on that kind of thing?
It's kind of the impossible question, isn't it, Katy?
It is.
So we need those family connections, and as much as we don't, and it's like I said, it's been such a uncertain and stressful and divisive last couple of years that I think we should try as hard as we can to find a way to compromise and be safe in however we plan things, but respect people's opinions. People aren't choosing to get vaccinated because they want everybody to get the vaccine or the virus. Like that, it's not. It's not an evil intent.
Right.
As a physician, I think it might be misinformed, but I don't believe anyone's doing it to be evil or to purposely put other people at risk. And I would emphasize all of us to find ways to make everybody comfortable and to have some compromise involved. So I know you're not a vacciner, but we're anxious about it with Grandma and Grandpa there at Thanksgiving. Do you mind wearing a mask just for that dinner time? If the incidence is very high, there's a different way of saying it than you're not invited if you won't get a mask or if you're not vaccinated.
I see.
Let's not draw hard lines. Let's see if we can't just treat each other and meet them where they are and compromise.
Mm-hmm. Yeah, I like that approach because you're right. We need those ties and we need that fellowship. And I had a Christmas party last year, and a physician attended and did want all of us in masks. And two of my guests did not want to wear masks, but they sat away from everyone else. So that was another way, okay, you don't want to wear a mask, that's fine. And I didn't even request that. They just understood. That they were going to stay kind of almost in another room with their hors d'oeuvres, and those two people, kind of just ended up talking to each other because the rest of us were in masks. And that was, again, after an expert said, I really would feel more comfortable. I know it's not a fun Christmas idea, but if everyone was masked up, and we respected that. So that's the word too, Dr. Whelan, is respect, for folks that are being careful. And we've always respected our local doctors, but you guys are on a whole nother playing field right now because in terms of mad respect in the community for our physicians, because this has taken a toll. I mean, you've had worked way too many hours, and same with our nurses and our healthcare workers. It's just been a grueling year, and you've got to be exhausted, Dr. Whelan.
Well, and the doctors are doing okay. I think it's important. I do want to stress that when mask requirements were relaxed for vaccinated people, they weren't for healthcare facilities. So the hospital and doctor's offices still were required to have everyone masked. Okay. And we have screeners at the door or at the front of the hospital, and the abuse that they have taken in the last several months. I mean, it's been off and on all year, but in the last several months, and its abuse has been appalling. And this is, again, where we just have to be open and compromise. You can have your beliefs, but that doesn't let you impose them on other people. And if you're going to yell at my screener who is just following the law, then that's inappropriate. And people need to keep aware that, again, people aren't asking them to mask to be evil. They're not asking them to suffer. They're doing it because it's required or it's safe. And a little bit of assuming good intentions of others would probably help all of us feel a little less stressed.
Well, that's heartbreaking, that story, but it's a story that needed to be told so that we all hold each other accountable in terms of being kind and being respectful. And we saw, I think it was you when we had you on the show originally, you were talking about our anxiety then causing temper flare-ups and us doing things that were not normal. And I shared a story about a friend of mine that doesn't like it when people leave their grocery cart in the parking lot and they don't return it to the corral. And this person said to me, the next time I see somebody leave their shopping cart in the parking lot, I'm going to go over there. And I said, are you going to do a citizen's arrest? I mean, it was just, I understand. It is about consideration of each other, but it's also before you react or before you get hot-tempered, slow down a minute and really think it through. Is that necessary communication?
And I also think it's a really good thing if social media triggers your anger, turn it off.
Oh, yes.
Unplug.
Yes.
Go out for a walk. Enjoy nature.
Right.
Well,
it's like what Dr. Whelan said about all these outdoor sports. Golf has also skyrocketed. Golfers, golf lessons. Again, doing something healthy outside that, takes your mind off of your troubles.
Right. And maybe the other way to think about it is if you want people to understand and respect your decision to wear a mask, you have to understand and respect someone's decision not to wear a mask, and vice versa. So if you feel strongly that you shouldn't have to wear a mask or be vaccinated, in order for you to, expect people to, listen to you and understand your reasons, you have to be able to do the opposite. You have to understand why some people do feel strongly about masks or why they choose to, and not think of it as there's only one right answer here.
It's all about putting yourself in other people's shoes.
It goes both ways, right. Absolutely.
In the minute or so, Dr. Whelan, that we have left, let's do a little summary of where we stand and what your recommendations are for folks.
So at the time that we're taping, we're starting the beginning of a surge. We've doubled the number of people in the hospital at the Munson Healthcare in the past week. And we expect that to continue for the next several weeks. So by the time you're hearing this, I would expect it to have doubled again, meaning that we will now be in an area with a time when we have substantial spread again, and most of that will be the Delta variant. So we're just asking people, you know all the right things to do. Some of them are second nature. We've loved not having our masks on, but it's time to put them back on in indoor spaces. It's time to, focus on outside socially distant activities, and it's time to really reevaluate your vaccines position. If you are on the fence and you want or need more information, certainly reach out to your primary care physician and see what's changed and whether that helps you feel more comfortable about getting vaccinated.
Okay. Dr. Jim Whelan, he is our medical director from Munson Hospital of Cadillac. Dr. Whelan, thank you so much for being such a resource to the community. Just talking to you calms us all down because you're so knowledgeable. So thank you for your service to Cadillac and being such a strong leader for us.
It's always my pleasure, Katy.
Join us next week for another edition of Cadillac Unscripted, sponsored by Independent Bank on 107.9 CDY.